Today we have a Q&A session for the patients who have been affected by the long-standing or acute facial palsy, which is usually called Bell's palsy. First question from Carrie. I was diagnosed with Bell's palsy in March 2020, and I have recuperated a lot from it, but I lost strength in my right eye and I still get headaches and stiff neck. I can't sleep on my right side because my nose gets stuffed and I can't breathe. What can I do? Kari, thank you for your question. Actually, there are a couple of them, so I will comment as much as possible on each part. From March 20 to up to date, we have today almost 2 years in. Indeed, apparently the level of damage to your facial nerve has been pretty severe, and it took you a long time to recover, and still your strength is not recovered, most probably because the regeneration of the facial nerve, which has been damaged, has not yet been completed, and some of the regenerating fibers have stopped before they could reach their respective facial muscle fibers. Your headaches and also sometimes aches in the face are most likely related to the fact that the very thin layer of the muscles which covers our head is also provided by with the electrical signals by the facial nerve, through the facial nerve. And when recovery goes on or takes pace, takes action, then some of the muscles may receive too strong signals, and they may partly contract or so that have a spasmodic contraction, which is painful. This is could be a little bit compared to the cramps that the person may have if you start very intensely training on the cold muscles. So to relieve those headaches, which are usually start on the surface and may then go deeper and involve the whole head, not only the affected side of the face or of the face, then it is recommended to do very soft, gentle massages, but not just quickly as I'm showing it. For obvious reasons, I cannot do it very slowly. Working on your scalp, always both sides, very slowly, trying to increase or improve the circulation so then as a result the local temperature will increase and the muscles will reflexively relax and provide some relief from your painful sensations. The same goes for the stiff neck. Also here and in front, the signals coming from the brain towards this area may be too strong because the brain was not able to communicate with these areas for a very long time. So as an opposite swing of the pendulum, it would just provide very strong contracting signals, which will result in stiff feeling here behind your neck, or even sometimes also, quite often, by the way, it may be here on the surface muscle of the neck, which is called platysma. So the same thing, do very gentle, not very forceful massages here, and also don't hesitate to massage with your own fingers your back side of the head, your back surface, rear surface of your neck, or otherwise, if you're not very proficient in that, but it's not a big deal, it's not a rocket science, ask someone else to do it for you. It doesn't have to be any special techniques, just a regular massage, relaxing techniques to make you feel supple, make relax, make balance, relieve extra tension of the muscles, and of course improve local blood circulation. About the nose, which gets stuffed, indeed here it's called alar muscle here, which holds the nose opening open. It's also a muscle which is provided by with the contraction signals by the facial nerve. It may so happen that that particular little branch of your facial nerve has not fully reconnected to that muscle, so that it folds in and it cannot keep your nostril open. Well, in this case, again, try to intensify the processes around this area by doing your own share to give a gentle push with your own fingers, with your own hands, so that your muscle reacts better to the signals that are provided to the facial nerve, and also that the nerve, even those incomplete recovered little branches, may function better. There is no quick solution to the issue that you are referring to, Carrie. So it takes time, and of course, if you are interested in more detailed analysis of your particular situation, don't hesitate to drop us a line with your particular question, or if you want to directly that we have a word face to face, let me know, and we will see how we can arrange that. Second question, Charlotte. Are there any vitamins or supplements you would recommend for someone 10 months post Bell's palsy diagnosis? Thank you, Charlotte, for your question. Usually vitamins B12, B6, and some other vitamins are being recommended for the patients in the acute phase of the facial palsy, because those are strongly believed to facilitate the regeneration of the injured or damaged facial nerve or other nerve tissue. At this 10 months post, I personally think that using vitamins at that stage will not make a lot of difference. Why? Because by the 10 months mark, an absolute majority of the regenerating facial nerve fibers have already connected or reconnected to their respective facial muscles, and those who have not reached their facial muscles have probably already stopped without reaching them, before reaching them. And that's why eating vitamins, which is in general good for your health, but it will not make a particular difference for your recovery. Next question, Kat is asking, I cannot visit your clinic in the Netherlands, but I would like to know what are the practical ways I can do on my own so I can reduce my synkinesis. I can feel stiffness in my affected area, cheeks and eyebrow, and involuntary movement in the mouth once I blink. What routine can I do to make sure that I don't overforce my facial nerve? Thank you, Kat. Very good question. Actually, several of those. We have actually on our website a special page which is specifically devoted to answering those questions in general terms, because of course each and every patient is in a separate case. Well, on the practical way, again, to reduce synkinesis, or at least to make them less pronounced, first thing which we would suggest, it may sound a bit counterintuitive, but nevertheless, do not force your face into facial expressions even when you are acting normally on a daily basis. It may sound counterintuitive because you think, well, my muscles are not strong enough or my nerve is not good enough, so I better force my face, otherwise my facial expressions will be asymmetrical. It is yes and no, but the trouble is that the more you force your face, the more unwanted co-contraction of other facial muscles will be happening. Because when you force your face, then you engage the motor cortex, which is basically a mimetic amplifier. So it is not specifically meant to move the face. Its limbic system is created by evolution to provide for the facial expressions, but the motor cortex voluntary system of facial movements is not specifically created to do that. So that's why it is difficult to provide voluntarily natural facial expressions, and our motor cortex tends also always to over amplify, to overdo, to overkill the efforts, and that is why the more you force your face, the more unwanted muscles may be contracting, which will in turn increase the tension of your face and will also result in involuntary contraction of your facial muscles, which is in fact synkinesis. Well, again, if you really want detailed advice tailored to your particular situation, don't hesitate to drop us a line so we have more time to discuss this. There is actually no one size fits all magical exercise or magical something that a patient can do and will eliminate synkinesis or dramatically reduce their manifestation. It's working against synkinesis or at rebalancing your facial movements is a process. It takes quite considerable amount of time and considerable efforts. So if you want to improve your situation, you should be prepared for a quite long journey, at least from our point of view. We do not use Botox. We don't use any invasive techniques. Our approach is to do it in a different way, addressing your synkinesis at their core, at their source, and other is complications after facial palsy. So it takes time, and I would be very happy to explain to you, to discuss with you your options, Kat. And indeed, we have several options which are available to the patients who cannot travel to the Netherlands. So we have developed them specifically during the coronavirus crisis, when our patients were actually had absolutely no way to come to the clinic for their rehabilitation programs. So we have developed also a way to work with them online, and that is one of the possibilities which I will be happy to share with you, Kat, or any other one of you who will find it necessary or interesting for him or for her to contact us for a more detailed assessment of your condition. Margie is asking, I had my attack on August 29th, 2021. I was wondering how long I should wait before getting a gold weight put in my eye. My eye doctor has recommended me doing it. Actually, Margie has asked a couple of questions, but they are all can be answered in short. I will answer all three of those. They're quite short. Well, the gold weight. Well, basically, gold weight is indeed sometimes permanent if your doctor advises you, or most of the time temporary effort, a temporary measure to, let's say, to help your eyelid go down. On the other hand, we are working on that specific symptom, which is not full closure of your eye fissure and slower blinking with our own approach, which is based on the fact that decreased amplitude of blink or extra forceful blinking that is necessary to close your eyes is thanks to the fact that there is a resistance from antagonistic muscle, which tries at the same time as you try to close your eyes or blink your eyes, it would at the same time, let's say synkinetically or co-contractionally, will try to lift your upper eyelid. That is why it takes longer time to close it, because you need to overcome its involuntary resistance. So we have a way. It's not a magical way, but it's included in the rehabilitation process that we work together on with our patients. So it's possible to do it. But if you want to put a golden weight, well, if you're really anxious to do that and really want to do it quickly and soon, and again, Margie, you are 76, so probably in consultation with the doctor, August, September, October, November, December, January, February. If I were you, I would wait another 3 months and then consider doing it if there is no other way that you would like to, or could find any other way to avoid inserting that weight into your upper eyelid. I'm 76 and I'm wondering if my age makes recovery longer. Yes and no. Yes, in a sense that if your nerve has sustained severe damage, severe injury, then the recovery, for obvious reasons, takes longer time, because your body is not 25 and not even 55 anymore. So all the processes, all the recovery, regeneration of tissue, whether it's muscle tissue, skin tissue, or nerve tissue for that matter, as far as facial nerve is concerned, takes longer time. So that is indeed correct. On the other hand, the fact that you may be confronted or already have been confronted with complications, which is synkinesis, increased tone, let's say pulling of your facial muscle, pulling sensation in your face somewhere just here above, or mostly it's the mid face and around the mouth area and the neck, surface muscle of the neck, platysma, then it is more or less the same dynamics for absolute majority of the patients who have experienced heavy damage and long recovery. For in that specific matter area, your age does not play a lot of role. only the initial speed of recovery of the facial nerve, its regeneration. I have really had no improvement since my attack. I have lost my hearing on my right ear. My balance is totally off and I'm dizzy a lot. My life has been turned upside down. That's still the third question from Margie. Well, the fact that you have no improvement since your attack and that you have lost your hearing in your right ear, your balance is totally off. I don't know if you have taken an MRI scan of your skull, so it may be that especially that you lost your hearing and your balance is off. It also indicates that your hearing nerve, either the nerve or the hearing apparatus, which provide us both for the hearing and for the sense of balance, has been affected by the either infection or maybe could be, not necessarily, but could be that there is a little tumor that is being developed, that is developing, and or has been formed earlier, and it still exerts pressure on your facial nerve and your nerve, vestibulocochlearis nerve, which provides for the hearing and balance. It is not uncommon that if there is a tumor, that it would, let's say, encircle two nerves at the same time. So the facial palsy will be accompanied by the affected hearing or the affected sense of balance. I do suggest so that you let your doctor, of course, take a closer look at the situation, see if there is any residual inflammation, if your facial palsy was caused by infection. Maybe it was an inner ear infection or bacterial infection or a viral infection. Herpes virus usually affects the facial nerve and also the hearing device. So I would, if I were you, I would try to get a hold on the underlying cause that prevents your facial nerve to recover, and also results in your loss of hearing, has resulted already in the loss of hearing and your impaired balance. Next question from Deepak. Are hemifacial spasm and facial synkinesis the same? Thank you for the question, Deepak. No, it is not the same. The hemifacial spasm classical definition is that it's involuntary, it's the nervous system disorder in which the muscles on the one side of the face twitch involuntarily, which means that it's not, synkinesis is the involuntary contraction of certain muscles which contract together with the other muscles which do not belong to that particular facial movement. So let's say, for example, when you blink, your mouth corner would move, or when you pucker your lips, your eye will involuntarily close. That's an example of synkinesis. The example of hemifacial spasm is that all of a sudden, without any attempt from your side, the face, half of the face would twitch. And usually the cause of this particular hemifacial spasm is not that much a heavy damage and subsequent recovery of the facial nerve, but what's called neurovascular conflict, which means that inside your skull, not necessarily in your particular case, but usually it's inside the skull, the nerve trunk, as it leaves the brain stem, sustains some pressure, either constant or pulsating from the pulse, from the blood vessel, artery usually, which compresses the facial nerve from one side and results in creating lots of parasitic electrical signals inside the nerve, which in turn result in involuntary spasm-like contractions of the facial muscles, all of those, or at least most of those. That's the answer to their question, Deepak. Next question from Keith. I'm approaching week 3 from my Bell's palsy diagnosis. I have been experiencing some hearing loss, outer ear tenderness, and ringing in the ear of my affected side. Does this align with Bell's palsy, or is it possible it was misdiagnosed? Should I expect my hearing to return when other facial functions return to normal? Thank you, Keith. Very good question. It is indeed very much in place. Look, as I mentioned before, in the false mouth, Bell's palsy is anything that is related to the loss of movement on one side of the face. But it's not entirely correct, because by the book, Bell's palsy is idiopathic peripheral facial paralysis. In other words, when no cause could be established of the facial, what has caused directly your facial palsy, then it gets a diagnosis, idiopathic facial paralysis or Bell's palsy. But very often it is possible to determine what has caused. It could be trauma, it could be surgical intervention, it could be tumor, it could be very clear herpetic infection. And in this case of Keith is describing, I would rather suggest a pretty severe infection. Most probably it is viral infection, which has not only affected the facial nerve, but also has affected the hearing device, so to say, the inner ear, which is very close. Everything is very close in our skull, but especially, as I mentioned in answering the question from Maggie, I believe, these nerves, two nerves that provide the hearing and sense of equilibrium, sense of balance, they run very close together. And if the infection is somewhere in the neighborhood where these nerves run together, then it is possible that it does not only affect the facial nerve, but also affects the hearing and vestibular nerve. So this is not a misdiagnose. Probably it is correct. So direct diagnosis is peripheral facial, unilateral peripheral facial palsy. But again, because probably the inflammation is pretty severe, that your other nerve has been affected. So the main cause, the main task now is to combat the damaging factor, which means to get rid of infection as soon as possible and facilitate the recovery process, both of your facial nerve and also of the hearing apparatus, hearing device, or the hearing nerve, if that's the one that has been affected by the inflammation. And all going well, you indeed should expect your hearing to return well in the course of general regeneration. But you need to realize that this is not one nerve, these are two nerves that run close together, and it doesn't necessarily mean that quick recovery of one function, let's say hearing and sense of balance, will immediately indicate that the other nerve will be recovering just as quickly. So it will be depending on the individual case. The next question is from Lucy. I'm sorry. I have regained some movement, but how have pain and balance issues in this? I have pain and balance issues. Is this common? Well, I have partly answered this question before. It is not. Doesn't happen very often, but pain, especially behind the ear, and balance issues, as I said, is an indicator of severe process, inflammatory or infection process or bacterial process, which affects both the hearing nerve and the facial nerve. And I have to say that this is, having those issues is not a very positive prognostic sign, which means that recovery may take extra time. Next question from May. Can viewing pictures of one's face prior to Bell's palsy, seeing how it was before, help with recovery in any way? Basically, it will, but not so much viewing pictures, but picturing in your mind your ideal face, ideal smile, ideal facial movement, picturing them without trying to move your face. That's important. Why? Because if you are frantically trying to move your face, you are creating what I said, over amplified signals, which are trying to get through your damaged facial nerve, but in vain, because the facial nerve is not yet recovered. But maintaining your mental image of your properly working face, proper well-balanced facial movements will maintain in your mind, let's say in your brain, so a proper image of your face, and also it will maintain kind of sensory imprint that your face is producing when you make symmetrical facial expressions, and sends to the brain. So the brain receives symmetrical sensory images, so the sensory pictures from both sides of your face, and imagining those will help to maintain it, because one of the causes from our point of view of imbalance of facial movements after a long recovery is the fact that the picture of one half of the face does not match, I mean sensory picture does not match sensory picture from the healthy side of the brain, and the brain becomes confused and starts to create different spectrums of signals to the healthy side versus affected side, and that leads to all kinds of troubles and asymmetry of facial movements and involuntary contractions of, for example, muscles that provide for the smile and the muscles that would pull down your mouth corner. That's why, although you are moving your face pretty well, or I mean not moving, where your efforts are quite high because of the involuntary contraction of the antagonist, your smile would not go as high as your healthy side would go, because here there is no resistance. Only the proper muscles would contract, move your mouth corner upward without any resistance. So that's why we can have something like this at the later stage when the, let's say, good side, not the good side, the healthy side is moving normally and the affected side is not, although a lot of efforts are being exercised, and it will also may also lead to the involuntary contraction of the eye, which is in fact oral ocular synkinesis. All right, next question. Valeria, I have had Bell's palsy for 2 times. One of them was in 2002, very severe. I had to take 1 year of physiotherapy every day. And the other one was in 2019. I'm 60 years old. Am I likely to have this syndrome more frequent than other people? Thank you, Valeria, for this question. Good question, because it's a question which, of course, bothers a lot of patients, practically all of the patients with whom we have worked, and there's a lot of patients with whom we have worked, whether it's going to come back, yes or no. Well, statistically speaking, relapse of the facial palsy is very seldom. Relapse on the same side twice is indeed also very seldom. Sometimes it does happen on one side and then on the other side. It is, I don't have a crystal ball, unfortunately. I wish I had one. If you use your common sense, okay, maybe it's a good idea that we talk with you, Valeria, in more detail, so I can see, I can ask you whether you had it on one side or on both sides, first on the right and then on the left, or both times on the same side, which were the circumstances, under which condition it has happened. It's a lot of questions. It does not have one answer that fits any particular situation with the same results. So I don't think that you have to be afraid that it will come back again, but of course use your common sense. What I mean by that: if it's cold or outside, use your shawl, use a hat, proper clothing. Don't expose yourself to direct cold wind. Don't go out with wet hair after you washed your hair. Don't sleep under the air condition if you're living in the area where it is hot, or under the open window when it's cold outside. And that kind of regular common sense measures that will keep your sensitive area here, which is could be sustain overcooling, and so that it will that those simple logical measures will help you to avoid relapse. It's not guaranteed, because maybe your facial palsy was caused by infection, ear infection, which we already discussed, or by the viral infection, which we also have touched briefly today. So it's a lot of questions which need the answers in more detail, which of course during this relatively short session we don't have sufficient time to do that. Next question, Marlene. When I eat, my eye tears up. Will this improve? Well, it's again a question which is needs a lot of other questions from my side. How far are you into your recovery? How long time ago your tearing has started? Is it accompanied by the other symptoms like synkinesis, facial pains, or tight feeling of your face, and so on. Well, usually, depending on the time, if you are, let's say, 3, 4, 5 months into your facial palsy, then most probably your tearing will somewhat improve. It will most probably not disappear completely, but this is very likely to improve. If you are at your, let's say, 3, 4, 5 years into your facial palsy, then the chances are high that the tearing, if you don't do anything, it will remain like it is. It's actually the same goes for synkinesis and other measures. If you leave them as they are not very likely to change dramatically. Just the time cures everything, but not exactly if it is a habit, if it's not actually a disease, but from our point of view, it's certain amended mimetic habits. All right, there was someone without name. Can the program be completed online? That depends. If you have let's say, regular Bell's palsy, a regular facial paralysis with regular, let's say, classical examples, well, yes, we can work online. At the same time, we do encourage our patients to undergo rehabilitation program in the clinic, because for obvious reasons, being face to face with your therapist and letting us actually touch your face is providing much better results. But for those of you who cannot travel by any means, then it is possible to work on that. I don't want to promise you that it will get 100% recovery as before, because it's in principle hardly possible. It is possible to improve it a great deal, but 100% as before, it will take a disproportionate amount of time. I mean, years, because from our point of view, as I said, it's a mimetic habit which needs to be changed. And we all know that it is much easier to gain a habit than to change it. Rachel is asking, someone suggested isolating movement during delayed recovery to help prevent synkinesis. What is it, and is it a good idea? Well, isolating movements, you can isolate your movements only by using, as I mentioned in the beginning of this session, your voluntary center of the brain. Actually, if I had a magical wand, or if I could find a switch to switch off that mimetic amplifier completely and leave everything in the able hands of your limbic system, which is a factor of emotions, which in turn is a product of evolution, I would leave everything to your limbic system, because the signals produced by the limbic system are always correct, always well balanced, always harmonious, and always depend only on the nature and intensity of the experienced emotion, or nothing else. All the imbalances in your facial movements, all the contractions, involuntary contractions, extra spasms and tension in your muscles, also some painful sensations just above your eyebrow, cheekbone, or along the lower jaw, is an indirect result of excessive efforts that your brain, either consciously or unconsciously, is exercising. That is why I would, let's put it this way: in our programs, we do not use facial gymnastics or facial exercises. Sometimes it's called physiotherapy. So we do not use those exercises which are aimed at pronouncing certain sounds, making certain movements with your lips, with your eyebrows, with your anything. We use other methods which are aimed to actually disengage that mimetic amplifier, which we actually do engage when we start moving our face at will. Next question, Shanik. It's been over a year since BP. I still can't pout or push my lips forward or round it on the affected side. Could this be cured? Well, actually, we are not talking about disease anymore, so there's nothing to be cured. Cure is about a disease. What you are facing now, Shanik, it's not a disease. It's a consequence or complication of facial paralysis, which you don't have anymore. You don't have paralysis. Your muscles are moving. They're moving in out of harmony fashion. but they are moving. So actually, we don't speak anymore about the paralysis or palsy. We speak about involuntary complications. And the most one of the most common symptoms is when you pout your lips, you can't push your lips forward or around them on the affected side, because usually together as you try to move your lips forward, so you contract the circular muscle of the mouth, the other muscles which are pulling your mouth corner on the affected side downward and outward are not relaxed. They should be relaxed as it is on your healthy side. Yeah, but when they are not relaxed, you get a picture like this. So actually, when you try to pout your lips twist to the affected side, because there are muscles which usually are supposed to be relaxed, because they are antagonistic muscles, they must be relaxed when the agonist muscle is contracting. They are not. And that's also because of those changed mimetic habits and changed mimetic patterns, and that it could be reduced a great deal. Indeed, we have most of our patients for that specific facial expression achieve quite impressive results. And the basic answer to your question is yes, it is possible to reduce. The next question, Henry. After 2 years of Bell's palsy and having synkinesis, what to expect from now on? I have partly answered your question, Henry, already. If you don't do anything, you cannot expect any changes in a considerable fashion. Because again, as I said, and it's also we discussed it quite in detail on our website, your facial movement pattern now is a habit, something which your brain exercises automatically without further thinking or without further consideration. It's like your handwriting. When you handwrite, you don't think about writing separately A, separately P, separately R, separately anything. You just write the word. It's the same, without thinking too much about how to move your hand. That's your brain movement pattern. It's actually you're moving. Your brain is writing, not your hand. Your hand is just a tool. Same way, your brain is making your facial movements, and your facial muscles are just tools which follow the signals, the signal pattern that is formed in the brain. So if you don't do anything, you're not likely to change, the same as you don't work on changing your hand script or your handwriting. You are not likely to experience having calligraphic handwriting all of a sudden just because. Someone who did not put his or her name, will Botox help the unlearning of synkinesis by the brain, since synkinesis happens when the brain relates several muscles to a single movement during Bell's palsy recovery? General answer is no, because synkinesis is mimetic pattern which is originating in the brain. Botox, which is actually a poison, botulinum toxin, what it does, it kills the place where the signal from your nerve jumps over to your muscle. It's called neuromuscular junction. So here is your nerve ending, here is your muscle. So the electrical signal from the brain travels to the nerve ending and then in a certain way jumps over to the muscle, and the muscle contracts. What Botox does, or botulinum toxin for that matter, it kills the source. So the signal arrives here and stops here. It cannot jump over. So actually, Botox is not addressing the issue, the core of the issue, the source of the issue, which in our perception is in your motor cortex, but just kills the connection site. It's in my I always quite often give this example. So if the switch is not working properly and the bulb is flickering, and you're fed up with flickering bulb, you just take the hammer and smash the bulb. But every time when you put the new bulb, it starts flickering again because the switch is still injured or is still damaged, and it provides intermittent voltage, which leads to the twitching or flickering of the bulb. That's why the Botox will not help you to unlearn. It will symptomatically reduce the intensity of synkinesis. That's correct. However, we need to realize that as long as your body is not stupid, if there is a damage, it will just grow a side branch, side terminal to reconnect to that muscle, and after some time, 2 months, 3 months, 4 months, 5 months, the same story will repeat itself again, because the nerve branch will reconnect to the muscle, and that flickering signal will start arriving to the muscle or to the bulb again, and the story repeats itself. That's why the effect of the botulinum toxin injections is temporarily, and it does not solve the problem for good. Cat, what are the signs of synkinesis getting better? Is it the contractions? No. The signs of synkinesis getting better is that when you do the same movement, the unwanted movement of the muscle becomes less pronounced. For example, when you blow your cheek, your eye from closing completely closes halfway. That's an improvement. So when you puck your lips, your eye from going this way goes only halfway. That's an improvement. Or when you blink your eyes, the intensity of your mouth corner moving together with every blink becomes less. That's the sign of synkinesis getting better. Question from Butterfly Family. What is your opinion on surgery for someone who has Bell's palsy for 6 years? Well, it's a general question, because surgery, there are a lot of options for surgical interventions. Well, we do not recommend any of those, except in general case of Bell's palsy. Because look, there are surgical intervention in the form of muscle transposition. So one muscle is being transposed to the mouth corner, connected, so that imitating the chewing movements would move the mouth corner. That's one. There could be nerve graft, so it will be part of your nerve taken from the calf muscle, and then your healthy side will be reconnected, usually this way, to the trunk of your affected side. They will cut off the trunk of your affected nerve completely, reconnect it to the graft from the opposite side, and then wait for 12, 13, 14 months, and then hopefully part of this movement, if you had absolutely no movement of this area, that's where actually the most absolute majority of the graft will take place. They're reconnected with the zygomatic muscles, so for the smile. But then it's still, from our experience, it does not deliver such a tremendous results. Again, I have no intention to discourage you. You ask for my opinion, I give it. And another one is selective neurolysis. It's also the same when the surgeon would open a certain area and will selectively cut certain facial muscle fibers, so that the, let's say, involuntary signals, contraction signals that are produced in the brain would not will not reach the muscles and cause their contraction. Of course, if you make a complete section of the nerve, facial nerve, I mean, there will be absolutely no movement of the muscle, whether with or without synkinesis. There will just nothing. That's why it's called selective neurolysis. So in our practice, we do not recommend, at least to our patients who comes for us to ask for help, we do not recommend any surgical intervention, because first, it's one way. Secondly, it's not always guaranteed to have success. And thirdly, as I said again, it doesn't address the cause. It addresses the symptom in a partial way. Latifa, I had facial paralysis in October 2016, and after 6 months of recovery, I had facial synkinesis. Now, is there a hope that this synkinesis will disappear? I already answered this question. The hope for that this synkinesis will disappear is not there. I'm sorry for my bluntness, but as I said, in our perspective, synkinesis is a habit. Habits by themselves do not disappear. Tony, is it possible for the infection to persist for an extended time? Of course, it is possible. Infection can become chronic. And so the question is general. Which kind of infection, where the infection is located, what has been affected by the infection, how long the infection has been there, has it been established that it is the infection that causes certain disorders or certain symptoms that a patient is not happy with. So it's general question, well, general answer. I'm sorry, Tony. Someone without a name, I recovered in about 1.5 months. However, it has been almost 9 months since, and I get muscle fasciculations in my legs and arms. Does the affected nerve cause that? No. Fasciculations in legs and arms are definitely not a symptom of Bell's palsy or facial paralysis, unilateral facial paralysis of any sort, if it were actually the acute facial paralysis. It may so happen that sometimes, if the facial palsy is a result of certain other disorders or infections or some other neurological diseases, then it could be related one to the other. But the classical facial palsy, Bell's palsy in the folk's mouth, is not related to fasciculations in nerves and legs. Someone without a name: is it possible to experience some tightness on the side that was affected even after months of recovery? I had BP about months ago. Yes, it is possible. And actually, it is one of the symptoms. It is one of the symptoms that very, very often manifest themselves. And tightness of facial muscles is indeed, as I also briefly mentioned during this session, is a result of increased contraction signals, also the signals for the tonal signals, which are directed from the brain to the affected side of the face. It is there, and it is very much possible that it will remain if you don't do anything about it, because it's a habit. Increased intensity of contraction signals for the facial muscle, both tonic and tonal and dynamic, to those who that provide for the facial movements, that level is increased. So again, if you don't do anything like at all, then that level of those signals is likely to remain. Of course, massages and some other, let's say, relaxing manipulations or treatments will help you definitely. And if you need more detailed advice, what to do, what not to do, we have a couple of pages on our website on which you can explore. We have a Bell's palsy knowledge base. Bell's palsy knowledge base, which contains a lot of information, both video and pictures and text, about what to do, what not to do, and how to address the issue that patients are having during the long recovery period. The Inquirer: have patients developed asymmetrical skin sagging and slower response on the affected side over time? After palsy 20 years ago, I have noticed the palsy affected side of my body responds differently. If I understand the question correctly, Inquirer, your questions is about asymmetrical skin sagging and the response on the body, on your body on the same side as that has been affected by the facial palsy. Indeed, it is possible that let's say the aging and the sagging, as you called it, of the affected side and the healthy side could be different. Why? Because for a simple reason, because if there is a different level of contraction of facial muscles for a very long period of time, it also affects the condition of the the condition of the skin, forming of all the lines and wrinkles, because the muscles for example, on one side are more contracted. So of course the nasolabial fold on the affected side will be more pronounced, or the muscles that would otherwise hold the eyebrows high when the frontal muscle is contracted, they may be sagging, and the eyebrow would be also sagging and closing. That's at least partly closing the eye fissure and that kind of things. But I would not relate slow responses of your body, I mean your arms, your legs, your trunk muscles, and so on, to that particular disorder. If that is the case, and if you really have trouble with those, then I would suggest that you go to a neurologist and ask him or her for a more detailed analysis of your condition. Maybe do a nerve conduction study, or do electromyography, or any other modality of the test, which may be or may not be related to your particular condition. I have Bell's palsy for 15 years now. It's 15 years now, and when I get tired, my eye gets smaller, my lips go on in a side. Do you think is anything I can heal myself completely. Thank you for your question. 15 years in, and when I get tired, my eye gets smaller. Yes, usually when you get tired in general, your eye, any other muscles on the face, many could also get tired, more tired than the muscles on the affected side, for a simple reason that any muscle on your affected side, and especially the eye, because it blinks 20, 30 times per minute, so that it exercises efforts, and if those efforts are very high intensity, and if the brain gives your muscles no time to relax, then it's only logical that you get tired pretty soon. That's why your eye gets smaller, because the circular muscle of the eye contracts. So it gets not spasm, but it becomes tighter. And it contracts, and involuntarily your eye fissure becomes thinner, more narrow, and it looks like your eye becomes smaller. And your lips may also experience some extra tightness. It's because, as I mentioned during this session, they're constantly fighting with the muscles that provide antagonistic contraction efforts, in overcoming those efforts, and that's a good reason, because they are constantly in overcoming resistance. They get tired and they can spasm, and then they may lose their suppleness, their ability to relax and move freely. That's why it may happen that by the end of the day, the patient may be only able to speak or to move the healthy side, because the affected side will be contracted all over. Again, spend some time on focusing on your face, relax. But there are I don't want to spend much time about particular recommendations, because they are also on the website. Kat is asking, does acupuncture help in relaxing the facial muscles, nerves? The question about muscles, yes, we cannot relax the nerve, because the nerve does not contract. The nerve just provides the signals. Either if it's a motor nerve from the brain, then it's from the brain to the face, for that matter. And if it's sensory nerve, which is trigeminal nerve, not the facial nerve, then it's sensory picture from the face to the brain, but it cannot be relaxed, it cannot be tense. Yes, indeed, acupuncture does help to improve the relaxation. At the same time, what we have gathered from our patients, it does provide relaxation, but it does not last forever. In some cases, within 1 day or 2 days, sometimes 10 days, that feeling of much better relaxed face fades away, because, again, as I said, let's say the shouting of the brain, go, 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 remains, and gradually pushes away the relaxing effect that had been achieved by the by the acupuncture. Dan is asking, when I wake up, my face muscles are very tight and pull on the affected side. Is there anything I can do to improve the quality of my sleep? Thank you, Dan. Very good question. Quite often we have these questions from our patients in the clinic. Look, the thing is that when we sleep, we dream. And then we dream, we experience emotions. And then we experience emotions, our face moves and tenses. That's why we can always see whether our children, when they are asleep, are seeing good dreams or bad dreams. We can see it from their faces. It's the same with our faces as adults when we sleep. And of course, as I said, because the brain over amplifies every signal that goes, emotional signal that goes in the direction of the facial muscles during the 8-hour sleep, or 7, 8, 6, 7-hour sleep. It goes constantly, and it can be influenced by your voluntary effort to relax your face, because you are asleep. You are not conscious about the efforts. That's why, Dan, you may wake up with the face tense. What you can do before you go to sleep, ask someone or do it yourself. Very nice, gentle, relaxing massage of your face. That will send nice symmetrical sensory signals to your brain. Always do massage symmetrical. I already mentioned in the beginning of the session. Always do it symmetrical, so that your brain receives symmetrical sensory signals from both sides of your face. So just do it supple, and then help your eyes closed, and then go to sleep. That will most probably help you. And another good advice, before you go to sleep, take a walk. 15, 20, 30 minutes. Just take a small walk. Not jogging, not exercising, not stretching, just walk. Walk for the sake of walking, not walk to the nearest shop to do your shopping. No, walk for the sake of walking, to calm down your nerve system, to get rid of all the stress that you have accumulated during the day. Take some extra oxygen, ventilate your body, ventilate your brain, supply it with a fresh air, and then it's very well known, of course, ventilate your room where you sleep. Don't seal it up completely, because, well, then you eat up your oxygen during the half of the night, and the rest you'll be breathing much less oxygen-rich air. So take a walk, relax your face with the massage movements, and go to sleep quietly. Well, this is more or less all the questions that we have had so far. Take some time and study our website. There is a lot of information. You may not be able to read all of it in one day, maybe not even 2 days, because there's a lot to read, a lot of process, a lot to think about. And if you have any questions, any doubts, any worries about your prospects for recovery, about your present condition, about your situation, about your pain in the face, about your involuntary movements, about the tightness, about your neck, about your tearing eyes, about any other issues, asymmetry of your face, especially asymmetry of your smile, and whichever other issues you may be having, please don't hesitate to write us a message, or just to fill in the simple contact form, which is on the front page of our website. Or if you are prepared to invest more of your time into in deepening of your knowledge and understanding of the situation better, if you need more advice, or if you want to consider going for a rehabilitation program with us, drop us a line. Don't hesitate. Usually I reply to any questions or to many messages, any completed inquiries within 1 or 2 days maximum, and then we can take it from there. I thank you very much again for your time. I wish all of you to receive maximal recovery. I wish you all to find answers to your questions, and the most important, to take action if you want to get improvements in your condition. Thank you very much, all of you. Stay healthy, stay positive, and God bless.